Well, over the last few weeks, we've been bringing you live interviews with local doctors to answer your questions about COVID-19 in Arkansas. You can text your questions to our tip line at 479-785-5055. This afternoon, we're joined by Dr. Steve Goss. He's the president of Mercy Clinic in Northwest Arkansas. Doctor, thanks for being with us.
Thank you, Erica.
So we're seeing a number of serious cases, even death in people 40 and younger. Have you seen this to be a growing trend as we continue to see more people dying from this illness?
Well, I don't know that I would call it a growing trend. However, as we see more cases, then those smaller populations, those smaller percentages of patients in those younger age groups that are going to succumb to it, we'll hear more about those. You know, when we first started this just a few short weeks ago, we were talking about how 80% of people would have mild symptoms or maybe even no symptoms. What we weren't quite as clear about, I don't think, at that time is even in the millennial age group, say 25 to 55, even those with that, there's still 20% of those that are going to require hospitalization. Even though we're obviously concentrating more on the 65-year-old and above and those with chronic illnesses because they have a much higher mortality, we still have to be cautious even in folks that are younger.
Sure. And when we talk about 20%, that's 1 in 5, right? So when you think about sitting there with your family at home, 1 in 5 could potentially be hospitalized, right?
Right. That is correct. Yeah. And even when we talk about mild, I think scientifically when they talk about mild cases, that could be from minimal symptoms even to pneumonia on x-ray, but you don't really require hospitalization. So mild cases could still have pretty good involvement, but it just doesn't require hospitalization.
Sure. We have a question from Rick this afternoon saying, what is the importance of getting tested?
Well, there's a couple of reasons. Number one, it's going to help you know what treatment you might need. Whether you might be more prone to needing hospitalization and close follow-up. The other would be to know if you're infectious to other people. In our instance, I think really around the country, and especially here in Arkansas, Northwest Arkansas, we don't have enough test kits to test everyone just to know if they have it or not, and to even know if they might be infectious or not to other people. We're really reserving the tests for those that have passed a screen of being at high risk for having been exposed or contracted COVID-19, and then for those that are being hospitalized, so we'll know for sure what we're treating.
Do you have any idea the percentage of people that you are concerned may be sick and may have tested positive but aren't able to get tested? What kind of percentages we're seeing of that?
You know, I don't know. I think everyone thinks there are more cases out in the community than what we know about. Obviously, they're not very sick or have minimal symptoms. But, you know, I don't really know that we know what the answer is to that question right now.
Sure. So we're also wondering, is the virus doing permanent damage to the lungs? Obviously, we know the impact of this can be on the respiratory system. Is there permanent damage?
Well, time will tell. I think there is a risk that there will be some permanent lung function reduction after recovery. Again, I don't know exactly what the experience is out of China, and maybe it's not been long enough for us to predict that for people. But I would say that we have to assume that there will be potentially some, and obviously the younger and healthier you are, the less likelihood or the less severe that might be. And again, the older with more chronic diseases that you might have, the more likelihood there might be. So that's a very good question. We talk about the mortality a lot, but then if you talk about morbidity and what some of the long-lasting effects might be over time, that's something that's yet to be determined.
Sure. We got this question from Mickey. He's saying, are you guys using hydroxychloroquine for any of your coronavirus patients? And if so, are you seeing encouraging results? First, can you let us know, for people that don't know at home, what hydroxychloroquine is, and then the answer to that question?
Sure. Hydroxychloroquine, also brand name Plaque.
We are back now with Dr. Steve Goss. He's the president of Mercy Clinic in Northwest Arkansas, answering your questions about COVID-19 this afternoon. Doctor, we've gotten this question from a lot of different people. They're asking, can a person still spread coronavirus if they have recovered?
No, not after enough time. And so, again, we were talking about those with mild symptoms earlier. If you kind of had that 2 weeks and your symptoms have abated, you have no fever over 72 hours, then you should not be what we call shedding the virus anymore. So there is a time frame after which you should not be contagious. So if you take into account that exposure, being ill, maybe a 2-week course, as long as you don't have any fever symptoms after that 2-week course, over about another 3 days, you should be safe to other people. Although I would say there's a good likelihood people will have a little bit of a lingering cough, just a dry lingering cough without feeling bad, without fever, without muscle aches and those other sorts of things at the end of the process.
Okay. Sheila's asking, does the virus stay on your clothes if you are around someone who's infected?
Well, if they've coughed on you and perhaps gotten any respiratory droplets on you, yes, it could. We don't know exactly what that time frame would be. So if you're in close contact with someone that you know has it, number one, I would avoid that if at all cost. Hopefully you're a healthcare worker and have on your protective equipment if that's the case. But yes, we do have to believe and just accept for now that the virus particles could stay around on your clothes for a while. And so you hear a lot about different healthcare workers going home, changing clothes in the garage, or taking off their clothes, putting them in a bag, taking a shower before they expose any of the rest of the family. Same thing here. If you're that close and someone's coughed on you, then you'd have to assume that it may be on your clothing. You need to get cleaned up.
And that's why it's so important to obviously continue the self-isolation, because if people don't have the symptoms but are sick, you could potentially pick up those respiratory droplets from them and not even know it, right?
That is correct, yes.
All right, we'll have more questions for you after this break. Stay with us. We are joined again this afternoon by Dr. Steve Goss. He's the president of Mercy Clinic in Northwest Arkansas, taking your questions about COVID-19. Doctor, we got this question from Rick. He says, is there any possibility that in the last 3 months or so, people with COVID-19 could have been misdiagnosed with the flu?
I think so. I think people wonder that we've not maybe had a low level of prevalence in the community for some time. I think everyone's suspicious about that. We certainly have a lot of travel in and out of China here in Northwest Arkansas. And here's why I say that is because often once we get into flu season, if someone has the typical symptoms, we don't necessarily do a swab on them anymore. We just have enough of it going around in the community. We can just say, yep, looks like you have the flu and we're going to treat you. And let us know if you get worse. So there could be that point in there where there might have been some patients with COVID infection that we weren't really testing to make sure. Once we became a little more concerned about COVID, then we were doing flu testing and even throat swab for strep testing to make sure it wasn't one of those two things before we then further considered it being COVID. But that is a possibility, yes.
If people are showing those symptoms, but they do test negative for flu and or strep, is that going to fast track them to potentially get a COVID test?
If they have the right screening factors, such as travel to one of the hot zones here in the United States, international travel, it certainly could. If they've been exposed to someone that is now tested positive, it could. However, there are still many other viruses that we're used to and accustomed to all the time. It doesn't have to be flu or strep. They got to have fever and sore throat and head congestion and cough. So, and we want people still to let us know about those things, because people that have a bacterial pneumonia are still going to have bacterial pneumonias this time of year, and we want to make sure we get them treated properly too.
Gotcha. That's why, obviously, a correct diagnosis is so important. We've gotten this question. Obviously, we know our restaurants are closed for dine-in services, but they're still doing takeout and delivery, those sorts of things. Kimberly has asked, if a cook or a restaurant worker has the virus but doesn't know it yet, can it be passed on through that takeout food that people are taking home to eat?
Well, number one, before someone has symptoms, even if they have been infected, the amount of virus they may shed is pretty low. Even testing them early enough in the course of the illness may not show positive. So that's a low likelihood. And I guess the question maybe has to do more around the food, perhaps, than the packaging. But I would not worry about the food so much. However, I think everyone just needs to be a little cautious. And, if you take a box or you take a bag, then make sure you sterilize your hands kind of before and after.
All right. Good advice. We'll be back with you after the break.